We're going to talk about a terminology, and that's the DGI. So when you say there's a disseminated gonococcal infection, what do you mean by that sentence? All right, disseminated gonococcal infection, DGI. So you know, so when you say disseminated, something is spreading so fast, it's complicating the whole body. You know, so for the disseminated gonococcal infections, you have a lot of things coming up. So you have polyarthritis, that's many joints are affected. There's inflammation. So they call that a migratory joint pain or joint diseases. So the knees, the wrists, the ankles, the elbows are usually affected by that. So it can mimic rheumatoid arthritis and reactive arthritis. Is where you now take up the synovial fluid, you test and you see that okay, those the organism causing gonorrhea is actually there. So that's Neisseria what gonorrhea. Okay, so there's Tenosynovitis, where there's inflammation of the tendon sheaths, especially in the hands and wrist. There's a lot of pain, there's a lot of swelling, and the way the person is moving that part of the body is greatly reduced. So there's also dermatitis, so some skin issues. So small pustular or vesiculo-pustular skin lesions often appear on the extremities. So lesions are usually few in number but highly suggestive of this. These are the pustular skin changes that we've been talking about. So other clinical features is fever and chills, you know, genital infections too, you know, in severe cases, purulent arthritis. So you diagnose this from blood cultures, where you get to pinpoint the Neisseria gonorrhoeae. Synovial fluid cultures, you also confirm the gonococcal arthritis by trying to confirm the Neisseria gonorrhoeae, and also nucleic acid amplification test. Clinical suspicion is actually strong diagnostically. That's the triad. This triad I spoke about here. Once you see these three things happening, it's a strong clue. Management is antibiotics, so intravenous ceftriaxone is standard. Then you also, as you are treating the person, you're also treating their partner because it's a sexually transmitted infection. So you don't want to treat the person, they go back to the partner, they still have the same issue.